Hi guys, today's our topic is cardiac output and we'll briefly talk about that. Coming to the cardiac output. So cardiac output is defined as the amount of blood ejected by each ventricle per minute. In other terms, it is the amount of blood that is ejected out. 70 ml is the stroke volume and how many beats? 72 beats per minute. So heart around 5 liters per minute. So here we can see that there are two factors. One is stroke volume and heart rate. Now we'll see. So cardiac output is directly proportional to heart rate up to a rate of 130 beats per minute. Because beyond that, the ventricular filling is compromised, which reduces the output. So we know that sympathetic nervous system increases the heart rate, parasympathetic decreases the heart rate. So proportionately, increased cardiac output is seen with sympathetic and decreased cardiac output seen in parasympathetic. As well as if we assess a person's maximum heart rate, it is 220 minus his age. So this is the maximum attainable heart rate. So coming to the stroke volume, the other factor which is dependent on preload, contractility of the myocardium and afterload. So preload is nothing but end diastolic volume and it is saying that it is directly proportional. So end diastolic volume is more, stroke volume will be more. We'll see that. And is directly proportional to the contractility of the myocardium. The heart as a unit, if it's contracting with more force, it exerts more output. Similarly, it is inversely proportional to afterload. So afterload is nothing but this is the pressure in the aorta. The pressure in the aorta will obstruct the outflow from the ventricle. So it is indirectly related, and if afterload is increased, stroke volume is decreased. Coming to the preload. Preload is nothing but the end diastolic volume. So we already know that end diastolic volume is more. The stretch on the heart will be more, and that will cause increased force of contraction. So it is also called as intrinsic regulation because it doesn't require any nervous stimulation. It is inbuilt mechanism of the heart, and is also called as heterometric regulation because the length of the myocardium is changing. As the length is increasing, the force of contraction is increasing. Now we can see that is explained by Frank Starling's law. What is Frank Starling's law is force of contraction is directly proportional to the initial length of the muscle. What is this initial length? It is the length of the muscle before it undergoes contraction. So more the initial length, that means more the stretch, more will be the force of contraction, and the stretch will be occurring with end diastolic volume. So more the filling of the ventricle, more will be the stretch, more will be the force of contraction. And without the change in length, there is one more entity called as myocardial contractility, which is also called as extrinsic regulation because it is acted upon by nervous system, sympathetic nervous system. And here length of the muscle remains constant, so it is also called as homometric regulation. And the inotropic effect is nothing but which is concerned with contractility. Positive inotropic effect means increased myocardial contractility, and that is done by sympathetic discharge as well as drugs like digoxin. Coming to the important parameter of the heart function, that is ejection fraction. So ejection fraction is nothing but it is a fraction of blood volume that is ejected out from the end diastolic volume. So nothing but it is the stroke volume that is ejected from end diastolic volume, and its ratio into 100, its percentage, we call that as the ejection fraction. Normally it will be around 50 to 65%. And there is another entity based on the surface area, cardiac output by body surface area, that is called as cardiac index, which is around 3.2 liters per minute per meter square. Measurement of cardiac output. There are so many methods for the measurement of cardiac output. One important such a method is based on Fick's principle. So Fick's principle is based on law of conservation of mass. What it says is the oxygen consumed by a organ is equal to a arteriovenous oxygen difference into blood flow. So we'll take arterial sample, we'll take venous sampling, and we'll measure the oxygen difference, and how much blood has flown to that tissue. We call this blood flow as cardiac output. Now, cardiac output is equal to how much oxygen consumed by AV oxygen difference. That is cardiac output. Another method is called as dye dilution method by Hamilton, which states that blood flow is equal to, or cardiac output is equal to I by CT into 60 to convert it into minutes. So I is the initial concentration of the dye injected, and C is the average concentration of the dye in the serial samplings, and the T is the first time appearance of the dye. It is the first time appearance of the dye, and which is measured in seconds. That way we are multiplying with 60 to make it minutes. So this is Hamilton dye dilution method. Another method, that is thermodilution method, where cold saline is infused into the vein and arterial sample is taken out and the temperature difference is taken. So the stroke volume will make the temperature or the cold saline to become warm. So dissipates the temperature. This is principle for thermodilution method. And we know that 5 liters per minute is the cardiac output, and how it is distributed to the different organs per kg per 100 grams of tissue or as an organ whole. So if we take highest blood flow ml per minute is nothing with the weight of the organ is to the liver, and lowest ml per minute is to the heart, and highest blood flow per 100 grams of tissue is kidney, and lowest with weight is skeletal muscle. And utilization, the most metabolic organ is liver, so highest oxygen consumption ml per minute here, and the lowest oxygen consumption is skin, that is also ml per minute. And coming to the highest oxygen consumption with weight, heart is the one, and lowest skin and skeletal muscle with weight. And maximum extraction of the oxygen occurs in the heart, and lowest oxygen extraction in kidneys. So the kidneys, even the blood flow is maximum. The blood flow maximum to the kidneys is not meant for oxygen utilization. That's why its extraction is lowest. It is concerned with filtration.